Since the pandemic COVID-19 strike, health awareness among the public has risen significantly, especially related to respiratory issues. Thus, it is important to have a biosensor that can monitor human breathing conditions. Breath analysis might play an important part in this decade by giving essential health data on demand. Moreover, human breath contains a wealth of physiological information that is particularly appealing for detecting aberrant breath patterns that indicate the early onset of disease and guiding and personalizing illness therapy. Human breath contains nitrogen, oxygen, carbon dioxide, water, inert gases, and about 870 additional chemicals. Our focus is to develop a sensor that can detect water vapor exhaled during breathing. The water molecules break into physiosorbed and chemisorbed layers and then interact with the sensing element layer made by semiconductor materials to produce additional electrons. These electrons can be detected when constant bias applied to the layer, in which the current reading increases and the resistant value drops simultaneously. Researchers are still struggling to achieve high detection sensitivity to monitor breathing, especially at low operating voltage. Production costs might be high due to the raw materials price and complexity of the production line. Some materials used are harmful and not safe for users and the environment due to their high toxicity. Most of the breathing sensors are not flexible and not designed for wearable medical devices, which makes users uncomfortable using them. To address the issues, we introduced zinc oxide quantum dots as the main element of the breathing sensor. Zinc oxide quantum dots are known as semiconductor crystals with a wide band gap of 3.55 eV and high electron mobility. Zinc oxide quantum dots are widely used in various areas including healthcare and medicine, environment, energy, and electronics. Their excellent electronic properties could give better sensitivity to the breathing sensor. Obviously, zinc oxide quantum dots are composed of zinc elements, which are abundant on the Earth and significantly cheaper than other metals. We use a cost-effective sol-gel synthesis method in which the final product is more affordable to the public. The zinc elements are also reported and proven to exhibit low toxicity that is safe for humans and the environment. The zinc oxide quantum dots are fabricated on a flexible substrate for wearable application. We use a simple spin coating technique as preliminary work for faster and cost-effective printable electronics production in the future. The zinc oxide quantum dots were synthesized by using the modified sol-gel method. Two precursors were prepared before synthesis, which were zinc and lithium hydroxide precursors. The lithium hydroxide solution was added to the zinc ion precursor solution and the mixture was vigorously stirred for 10 minutes to form a homogeneous solution. Finally, white solid zinc oxide quantum dots were recovered by centrifuging the solution with added excess acetone to induce precipitation. The obtained white solid zinc oxide quantum dots were then redispersed in ethanol and spin-coated on the interdigitated sensor electrode. The size of the synthesized zinc oxide quantum dots is less than 10 nanometers, proven by the transmission electron microscopic analysis and X-ray diffraction. The sensor shows stable and reliable electrical properties under 100 times reading cycle between -5 to 5 volts. The sensor was then placed in the fabric mask and connected to the Arduino controller system that enables breathing patterns to be monitored through a smartphone using a Wi-Fi connection. A simple demonstration shows that the device is highly sensitive to detecting the breathing patterns of humans. So far to our knowledge, this is the first demonstration of zinc oxide quantum dots-based breathing sensors. The research work is the potential for a highly sensitive breath monitoring system for affordable personal healthcare diagnosis. The current cost to develop the prototype is about 550 ringgit Malaysia. However, we believe that the mass production cost is expected to reduce to as low as 50 ringgit Malaysia, which is considered affordable. Features and benefits of this device are including early detection of health issues, personalized healthcare management and data privacy, wearable and tracking activities, revolutionize of healthcare by point of care, and better treatment plans for all family members. In the future, we plan to add more sensors to build a multisensory device that can detect many biological activities for healthcare applications. We also want to improve the system by embedding artificial intelligence for chemometrics analysis and collaborate with the Ministry of Health Malaysia to develop a data security and blockchain system to facilitate doctors in diagnosing and monitoring patients remotely. This will significantly resolve many healthcare issues, including reducing overcrowding patients in the hospital, saving patients time and money, improving the healthy level of the people, and saving more lives.